Good morning, everybody. I see people are still trickling in. I'm going to give this 3 more minutes to let everybody get logged in, and then we will begin. Good morning, everybody. We're about to get started. Um, Before we begin, just a few housekeeping pieces. We've got a lot of material to cover. It'll be flipping back and forth here. So if you have questions along the way, please put them in the chat. We may stop partway through to take a look at those. Otherwise, we will look at those and respond at the end of the session. In addition, please remain muted throughout the presentation again, and we may be able to take questions afterward. This webinar was scheduled for 2 hours. I do not anticipate that it will take that long. I just wanted to make sure that we had space and time available if necessary. Um, so having said that, I'm going to get started. Okay. So Why are we here? You may remember we did a presentation on the PIR in October, and in fact, you will recognize at least some of the slides from that meeting. And so you may wonder why we're here again. And the answer is that I don't have all the data that we need to report the PIR. We have a busy summer ahead. We're going to be doing a pre-service for real before the beginning of the year, this year. We're going to need to go through rollover and CSD cares for real this year and get everyone in place before the beginning of the year. That process, as we learned last year, does not work if you wait to set up next year until after the year has begun. So we have all this to do in the summer, and I just cannot spend the summer hunting people down and getting them to give us missing information from the PIR. So what you're looking at right now is a screen. This is the tab in the PIR spreadsheets that we sent out to everybody that is marked important in red, and that this has the due dates for various pieces of information throughout the program year. So you will notice that the very last date here is May 30th. Okay, so I realize that we do have many year-round programs in the city of Chicago. So they begin in September and end in August and then immediately start again. But the only things you should be adding to the PIR during the summer are new children who have enrolled starting with June 1st or later. Anybody who is enrolled now, we need to have all, that is all, of their information in there by that time. So when we talk about the end of the program year for reporting purposes, because so many people do drop and there are so many changes, we are talking about the June status. So I will cover this more when it comes to HR and so on, but if you're moving teachers around and reorganizing where people are over the summer, I don't really care and I don't want to know about it. Other people do, but in terms of the PIR, I want the setup that we had during the program year. So let's do it now and be done, and then we won't have to come back to it, and I won't have to be nagging anyone over the summer. Okay. So some of these dates passed quite a while ago. We wanted all of the enrollment stuff in. Obviously, there are new children who enrolled later, but children who enrolled at any point during 2024, we would like all of their information to be here now. And the reason for that, beyond the fact that we have a lot going on in the summer, is that we need data. We use the data in here for enrollment reporting, for tracking health status, for tracking developmental screenings, to monitor our progress towards reaching 10% of children with disabilities. So if that information is not in here, we don't really have a way to get it out. I am hoping that over the next couple of years we will be able to get all of that information out of our information system. Right now, the PIR, although many other reports are getting much better in recent weeks, the PIR is not there in usable form right now. So we are still doing the programs this way and monitoring through these spreadsheets, and we need to get them up to date. So before I get into details, and we're going to get into some pretty specific details here, let's talk about the PIR. The PIR is something that we have had to submit every year, going back to 1978. It's PIR, short for Program Information Report, and it is the Fed's primary source of information about our programs. And they use this as both to get information on Head Start as a whole for reports to Congress, but also it is their first look in at how we are doing in meeting program requirements. And anytime um, federal reviewers come out to look at programs, those people have looked at our PIR before coming. In this past round of federal reviews, you will have noticed that they put a lot of emphasis looking at health screenings, health status, developmental screenings, getting that stuff done within 45 days. And that's because we had, over the several years since our previous FA2, we had turned in several PIRs that looked like we were falling behind in those areas because we didn't have all the documentation to show that we were getting those screenings done, getting those physicals in, and so on. So they look at it and form opinions based on the information that's in here. It has to be submitted every year, no later than August 31st, by law. And I am here to tell you that is my deadline to get the information in. That is not yours. There's very little that we can do with it if you're giving us information on the last 2 days. We have 50 reports to turn in, and it takes a day to do each of them. So that's why we gave due dates that are before that point. In addition, my only child is going to college this summer. The last week in August is move-in. I will not be here to help you. I'm just going to put that out there. So the due date is before then. Get everything to us by June 1st. Moving on. Where can you find the PIR? Well, first of all, what's in it? And there's 4 sections now. People who are here for a long time will know 3 sections, but a couple of years ago, a 4th section was added. So the first section is program information. This is things like how many sites and slots do you have? Do you have partners? How many funded slots? By program option, how many children were enrolled? How old were they? Demographic information. Section B is about program staff and qualifications. This is where they look at teaching staff and family and community partnership staff and look at qualifications that those folks have. And it also is where we document our volunteers. And section C is the big load. It's child and family services. Everything about from family partnership to health screenings and so on is reported in that section. And then the new stuff, they have moved some information to the grant level. So they used to ask for every agency about the education and salaries of management staff. Now they just want us to give an average for those positions across the entire program. So some of that information we can collect from people offline. We're just and through a variety of different means because we're just throwing together an average as opposed to documenting everybody individually. Before we go on, I want to just stress again, please be sure you're muted. I can hear some background conversation and it's I prefer not to. Okay, so you can in fact see the entire PIR before it is submitted. Second. Okay. All right, so you can find the PIR itself at headstart.gov. The link is here, but you don't really need to remember this whole thing. What you can do is just go to headstart.gov and then put PIR in the search box. That page looks like this. So a couple things. You actually already know most of what you need to know about the PIR in all likelihood, because if you look through this, you will see the current year which is due this summer, there are currently no changes. So we are still using last year's PIR form. Normally they come out with a new one every year and they do a list like this that has minor changes. But so far we have heard nothing new, although I would say, let me see. Let's see if it's open yet. This, what right now you're looking at is the Head Start enterprise system. These are all of our grants, current and former. So this is where it actually gets reported. And as you can see, the 2025 PIR is still not available. At this point, we assume it will be the same. For one thing, I guess there's enough going on at the federal level, and I don't expect anyone really to be working on pulling a new one together right now. So we can assume that this will be the same. So this is last year's report. Let me make it bigger. Okay, here's last year's report. Everything that we put in the spreadsheets that you're looking at to submit information is based on this document. We work backwards to figure out how to get the number that we need for each field from this report, but it is useful to look at this because we've got a section of definitions here, and again, anytime that you have an item to be entered, there is a lengthy discussion about what it means, what we're looking for, kind of the format that we're looking for. So I'll refer to this as we go through, just so you can see we're not making up strange requirements for you to fill in. All of this is based on the reports that we have from the feds. Okay. So data collection is being done through the spreadsheet that we share with everyone. We've been collecting it this way for a couple years now. So I just want to go through a few things. I have a dummy report that we're going to be working with. So we don't have actual child, teacher, or center names, although it is based on some real data so that you guys can see what we have and what kind of things we're missing and how to tell. So if you look at this, first of all right, so here is my PIR test agency spreadsheet. So we're looking at the child enrollment tab. Here again is the important tab. This goes through and tells you what needs to be submitted by when. So this was never a secret. Okay, so the enrollment tab. So a couple basic navigation things. If you want to look at a specific site, anytime you see a down arrow like this, that means it's a field that can be filtered. This is how the filtering works. So I'm only going to look at Jennifer's daycare here. That's restricted. Okay, but if I change my mind and I want to look at gingerbread house, here we go. So that's how that works. So if you see this thing that looks like a funnel, that means it's filtered. So you don't have to call us in a panic and ask for it to be unfiltered. Click on the filter and hit clear. That's all that has to happen. Okay. The second piece is that it's coded so that with what we call conditional formatting. Conditional formatting means based on what the response is, the field that we're looking at is a different color. So if you look through here, you see anything that's blank is yellow. And by the end of the year, for the most part, I didn't want anything to be yellow. Now here is the end date. If the child is still in the program, it's okay if this is yellow. If they're not in the program, then we need an end date, and we would like to know whether they transition to another program. Okay, because that's one of the questions in section A, and we need a head count to report that. So that's all right. But here, I'm looking at this one, and I've got more yellow here. Look at this: developmental screening date, social emotional screening date. Was this child identified as needing follow-up assessment? And these are blank, and that is not okay. We use this to track who has gotten their screenings within 45 days and who has not. And so we have a case here. They have an enrollment date. Right, so here, the enrollment date is October 11th, 2024. We hopefully indicated what would be the due date. When would 45 days come up? We actually made it a little bit shorter to give you a warning. So that would be November 14th. They still haven't had one. So they're not up to date. And we had to share this information as bulk with the feds when they were doing our follow-up review. So I was not particularly pleased to see that some of these were still missing. Please make them not be missing. The due date for that, when was that? Oh yeah, October 8th. So please complete it now. Okay, so that is part of section C, but we put it in section A on purpose because we wanted it done first, and because the 45 days are actually counted from whatever date put in here as the program start date. So putting it on the same page made it simpler. Okay. All right, so the basic program information is here. We've got classes, groups, and centers. How many classes were operated, services delivered through child care partners. Okay, so we have a class data page. Again, these aren't real people's names. I've got my whole Game of Thrones crew going on here, but this is the kind of information we need to see. So per class, every line here is a class. We've got the teacher, we've got the assistant teacher. We asked for the funding. That's how we're filling out that section of the PIR, right? Total number of slots, total number of classes. Again, we're not making this up. So we want to know how many are active, and then we get into children by age. That's why we need the birth dates and so on. Okay. So I don't want to belabor this, but again, we really can't. Once you report the number of classes, then we need to have enough adults in the room on the report to add up. So that would be for each 3 to 5 year old class that we report, we would have a teacher and an assistant teacher at the very least. And for each early Head Start room that we report, we need at least 2 teachers. So when we look through here and it's a missing teacher, I can't really report, Ms. Vacant as the teacher. I actually need one. So if someone has left during the year, we need one of 2 things. You either need to leave them on the report until the replacement is there, or get a substitute and put the substitute's information in there, or let us know that the class is closed and there are no children attending that class, and then we can remove it entirely from the report. But we cannot We cannot say for your site you've got 10 rooms and have less than 20 grown-ups. Like, they've got to be, the combination of teachers and assistant teachers has to be 20 for 10 rooms. And we just can't report a vacancy. So either the room is closed and there are no children being served there, or someone is that room and we need to know who that is in order to report. Again, we're talking about the status during the school year. So if you're reducing the number of classes over the summer, that doesn't matter if you're moving someone to a different class for June and July. I'm not that interested in that, right? We want to know how it was operating throughout the school year. But for the school year, we cannot be reporting a vacancy. I gotta have a teacher. Okay. So then comes cumulative enrollment, all of the data, count everyone who was enrolled at least one day throughout the year. So if you have children who drop, you're not going to remove them from the spreadsheet. You're just going to add an end date, right, which we went over a minute ago from the child data. You put the end date here. So if this child dropped, would be, I don't know, 3, and then see the status has already changed, and now it says, yes, your child did leave during the year. If they left the program, did they transition? Yeah, I'm going to say, yeah, and there's another early childhood program, and leave it there. So that's how that works, but we do need them on there. So in the unlikely but possible circumstance, because we have 3 early Head Start grants, so when we look at enrollment type here, right, we've got Early Head Start, we've got Early Head Start Child Care Partnership, and we've got Early Head Start Expansion. Okay, so different group of kids. And this is what we do. We filter by that to get the numbers that we need for each grant. So if in the unlikely but possible circumstance when a child has moved from one grant to another grant, they actually need to have 2 lines on the spreadsheet. You can't just go in and change the grant. You have to copy the entire line and put everything in. That way they will show up, for example, on the Early Head Start report and also on the Early Head Start Child Care Partnership report, which they should count twice because they're separate grants. And each report is cumulative and it covers everyone that's required, that's participated during the program year. Now, our program officer at Region 5 has stressed to us that she doesn't want us doing that. If a child starts in CCP, they shouldn't switch halfway through the year to the Early Head Start base grant. But I know sometimes it happens, particularly when we don't have enough teaching staff and need to consolidate rooms and so on. But as much as possible, we're trying to avoid doing that. Okay. So we went over that. Again, how many children were served? We need all of them because we have validation when we enter it on the federal website, the Head Start Enterprise System. So if we put 13 children in and then we only say have 12 birth dates or 12 ethnicities on there, we get an error and it says the total has to add up to the total number of children. So we can't go with blanks. And for many questions, there is no option to put other, so we can't go with other. We need to complete the documentation. So a lot of these tips, if you see here, some of the fields in the PIR have a little triangle here. That means there's a note. If you click on the note, it'll give you text describing what you're being asked to do here. So again, enrollment type. We've got a little paragraph here. What does this mean? Right. So just to clarify some of this text, we took directly from the PIR form itself, but others were being specific about what that means in the DFSS context. So here we go, like the children that were entering, please don't include children who left the program before the beginning of the program year. We don't want to deal with a lot of last year's kids and have to filter them out of everything to make reports. Okay. But you'll see all of those notes when you see a little triangle. Just click on it to see what it says. There's a question now about chronic absence. So on our spreadsheet, it gets towards the end here, it's going to ask, was the child chronically absent? That is 10% or more. So I want to say this about the status here. You have them. So, and I know this because chronic absence here is defined as children who are absent more than 10% of the year. So, and this is an individual basis. So first of all, this is all absences. This does include excused absences. It doesn't matter that they were on vacation or sick or whatever, it still counts as an absence. And so if your overall attendance is around 85%, which is likely because that's where the overall attendance for all the program is, that means obviously you have some children who attended less than 90% of the time, because that's how math works. If all of your children attended more than 90% of the time, then your average attendance would be more than 90%. It's not, so there's chronically absent children. So we need to figure out how many of them there are. You should do this to find out who they are and work with their parents to get them to come more often. This whole indicator actually comes from a study that was done in Chicago at early childhood programs at Chicago Public Schools. And what the study, which was done over a number of years, found was that children who were chronically absent from preschool classrooms were more likely to be chronically absent from elementary school, and were more likely to eventually drop out of school. So it is an early warning sign when kids don't show up most of the time to a program in which they're enrolled. And so if you can work with parents to improve their attendance, this actually may end up having lifelong benefits and improve outcomes for years to come. So this is an area where intervention by those of us in the early childhood education community really can make a difference, at least according to studies that were done in our communities. And so we should be paying attention to it and doing what we can. Okay, now turnover, we also ask on the PIR, how many children left the program, how many of that was within 45 days, and did they go somewhere else? So in order to do that, we need these fields filled in on the actual spreadsheet. Again, I think we went over that a minute ago, but let me just to be clear, because we do need this, like, okay. So if we got a start date and they leave, we need the end date. This is, we're automatically calculating this because we're not just asking you, did they leave the program? We need to know when, because if the number of days is less than 45, that's a question we need to answer. So again, we're not just doing this to be difficult. All of the things that we ask on here, we do need. So at this point, if we have children added to somebody's spreadsheet and we don't have any other information about them, I mean, they need to either be completed or just remove them, because if we don't even have a start date, we don't have status and so on for them. go, then we can't report them. The other piece that when I first did this, I didn't think it's on the list of due dates, but I didn't think it would be an issue enough to specifically point this out in the fall. But everybody who is eligible for a Head Start or early Head Start program is eligible for a reason. So when they're enrolled, we need to know what that is. So we have a primary type of eligibility, right? Here's the options: at or below 100% poverty line. And then we got the categorical eligibilities, which would be foster care or homeless. And then we've got here, we have SNAP included, but this could be SSI, and this could be TANF. Those are all specific items under what they call categorically eligible because of receipt of public assistance. But you will see now, as opposed to in the past, it was just one line. Now they do break it out by type of public assistance, so we need that to be specified when this is filled out. Okay, so when I have an agency, and again, this is fake names, but it's based on real data. Okay, and I'm looking at this stuff, and they are missing. Let me take my stuff here so I can see exactly what it is. So I've got 10 kids here, and they are missing a lot of information, but any kind of eligibility. So when people from this agency ask me if they can have an over-income enrollment approved, the answer is no, because I cannot tell whether they are at 10% or not, because there are still children, and I don't know if they're eligible or why they're eligible. So this needed to be put in at enrollment. There's many kids that I'm looking at. This isn't the only one, so that's I'm not going to name and pick on them, because there's a bunch of them. But when we have people who had an enrollment date and they put, oh, they started coming in August, September, January of last year, okay, but we don't have a type of eligibility yet. Still, I mean, that's a problem that should have been in there within days. The eligibility interview, where you go over their documents and determine whether a child is eligible, is actually supposed to happen before they start attending. So if it's been 6 months, that's an issue. So please look at this. If this is yellow and blank for anyone, please get it done within the next couple business days. I mean, there's just no reason for this not to be done. And that will make it easier for us to figure out where we are in terms of our status with the over-income enrollment and whether we're at 10% or not. And then I'll help you get them in CSD Cares once it's documented here, but not before. Okay, so that is section A. All right. Section B is program staff and qualifications. So the first thing here, all right, volunteers. If you are counting any volunteers as part of your non-federal share, as in-kind contributions, you need to give us the information about volunteers. You're supposed to, here we go. This is straight from the form itself. If you need to include both classroom and non-classroom volunteers, and you count each person only one time, no matter whether they've been there and done 1 hour or they've regularly been coming in a couple times a week. Okay, so here, this is on the first page. This is your general agency information, which was due right away, and in many, many cases is still completely blank. Please go in and complete that now. But here we asked the number of volunteers, and of those, how many are current or former Head Start or early Head Start parents. So We've got a column for each federal grant. So you can't count them twice. Like if they have two kids and they volunteered for uh, Head Start when they had a younger kid who was an early Head Start, and they balanced. You can count them under both grants. That again would be a parent. Non-parent volunteers would be on this line, but not this line. So we just need a number. I don't need their names. For next year, we really want to come around and try to get hours again like we could out of COPA. Because the community service block grant asks for that for all programs funded at an agency that is CSBG funded, which includes DFSS. So even though they're not paying for these volunteers, they want to know the number of hours, and we have struggled to get that. So you'll get more information about that next year, rather. Hopefully we will be able to begin documenting those in CSD Care soon, but not for this 2024-2025 program year. Those are the volunteers, right, on the general agency tab. Should be done by now, but it isn't, so please do it. And then we've got program staff and qualifications. Again, this is mostly classroom staff. Management staff have been moved, as I said, to section D, and that is an overall age average. So for executive director, we're going to average all 20, some of them, and give them that number. So we'll be able to send that to us separately if you were comfortable with that. So for reporting, if you have non-Head Start staff, you don't need to report on them if they're not working with Head Start children or families. But if you have a teacher in the classroom, even if their entire salary were paid out of Preschool for All, for example, but some of the kids in there are Head Start funded, we still need that teacher included, because we need to have enough teachers again for all the classrooms, and need to make sure that they're Head Start qualified. So these are from the FAQ on the federal website, by the way. So there are more questions like that which you can access there. Many of your questions might be answered already. So for early Head Start, there isn't a line for assistant teachers. Here they're saying report everyone as a teacher. I don't really want to do that. If they're qualified, yes. Otherwise, you should have 2 qualified teachers for class. Please include them there and make sure we have all of their information, but we probably won't report additional teacher aides and so on if they don't meet the qualifications, because that triggers follow-up questions about what we're doing to get them qualified, and so on. Right? So we need the teacher salaries, and that is an item on the federal form. We can't report it without it. It is required. I know people aren't comfortable with sharing with that, but it's a federal law that requires you to do it. So I guess be uncomfortable, but you need to give us the information. We are not going to list any of the individual people's salary on the publicly available information. Again, we're averaging everybody together. But we need to have the individuals so that we can do the average. Okay. So as with other sections, it's yellow when it's blank. We need you to go in there and complete this. so that it's not. So here is HR, for example, got a bunch of fake teachers. Um, so employment type, which is going to be filled out here. This is like, is this a temp or is this permanent staff? Like that. That's what we're finding out here. Again, the way this is, I can figure this out because they've combined the degree and major in the same answer here. But here, like none of the qualifications listed. We need to know why. That's like a blank that we need to fill in with text on the report that we're submitting. So if you don't fill these things, we're just going to have to follow up with you. And as I mentioned, we really don't have time. So just please make it not be yellow. Um, let's see. So even if it's no, I know it seems ridiculous. Just put no, and then we won't bother you. This is appropriate. The option, yes. Okay, so this is all right if they're not enrolled, but if they are not qualified, they should have a professional development plan. So you should say, what degree are they looking for? What are they trying to get? And then we need the salary again. If you only have one of these things, whether it's hourly or a salary, we can figure out a stand-in for the other, but we'd much rather you give us both. By figuring out a stand-in, I mean that a full-time 40-hour-a-week worker works 2,080 hours a week. So you can multiply and divide by that to get the hourly from the annual or the annual from the hourly. But we would prefer not. But again, this information is on the PIR. For teaching staff, we need to know what's their primary language, right? Do they have a secondary language? What's their ethnicity, right? There we go. We just need this to be filled in for everybody. Please don't make it look like this. It is required. They'll make us come back and get it. It's a waste of time. You already know. I'm telling you right now, it's required. Please just do it. Okay. That's that. Again, turnover. This is, again, we need to know how many people left. So this is where, like I said, if you haven't replaced them, don't delete them from the class or the HR tab, because then we don't have enough teachers. So if a teacher has gone and they haven't been replaced, leave them in the class, because that's the most recent teacher, and that's what we'll put for the information in section B. You will document the turnover on the turnover tab. Where's the turnover tab? All right. So employee turnover. So this is where you say that they've left. You include them on turnover if they left. Were they replaced? Right? Did they leave while classes were in section? Yes. Has the position been vacant 3 months or longer? Yes. So if someone left and they haven't been replaced yet, this is where you document that. But don't take them out of the class tab and put vacant, because then what are we going to do? We can't finish the report. So they need to stay here until they're replaced, and you will go to this different tab here, and this is where you will note that they left, when they left, why they left, and whether they've been replaced. So just to be clear, again, we do take backups every once in a while, but we've got a live shared spreadsheet, so we don't really want you to go and delete things. So again, your teachers leave. Don't erase them, just add them to the turnover tab. You will replace them on the teacher sheet on the class tab if they've been replaced, but don't replace them with a blank. Can't do Miss Vacant. So here we go. So the third section is Child and Family Services. These are health services, disabilities, developmental screenings, family and community partnerships. This is the biggest chunk of the report. As I mentioned before, the developmental screenings and the health status determination are on the enrollment tab because we needed them right away, because we needed to be able to say in 45 days how many children were screened in 45 days, and then in 90 days how many children had a determination of their initial health status within 90 days. So that's why it was there. It was in the first section. We were hoping to get everybody to put that information in. We did, as I mentioned, have a follow-up review with the feds. We were able to report that that number had improved. We could now show that we were over 80% in terms of determining health status, which they accepted and said the situation has been resolved. But you and I both know that that's more than 80%, because at least for center-based services, you gotta have a physical to comply with childcare DCFS licensing requirements, and so you do have a health status. And the issue is that that was not documented on the PIR spreadsheet in time for the federal follow-up review. So please get in there and make that status be the 100% that it should be. So we already looked at that section, so we're going to move on. So again, this is I showed you this already on the live sheet. This is how you determine from the enrollment date, the 45-day due date, the 90-day due date, and where you can find specific information describing what we're asking when it relates to the screening information. Again, it's those little red triangles. The other thing that I want to point out here, which you may have noticed, is that when we talk about health data and family data, you can't edit these fields and you can't change any of this information. This is mapped to the enrollment, so they'll be on the same line. So I've got a kid here that I have obnoxiously named Capital Idea, who is on line 16 of the health data. You'll notice that this came straight from the child enrollment data. If I look for where, right, to remind you how to do that, line 16, same kid. If you look over at the family data, line 16, it's going to be the same kid. So this information, once you enter it on the first page, it gets copied over to the other pages. That's the way we can make sure that we have the same number of kids, they're the same children, and so on. Okay. So in Section A, we've been asked to report on how many children have health insurance, whether that is a Medicaid or CHIP, and then it calculates the other numbers automatically. So again, there is an at enrollment and end of enrollment field. We just took that information and we put it right on the PIR here. So child insurance at enrollment right here, child enrollment at child insurance type at end of enrollment right here. So again, we don't want you to wait to report the end of enrollment information for August. This is what we're asking for. If the child is enrolled all year, then by the end of May, go back and put this information in. If a child is leaving the program early, so a child who has dropped, their year is over. This is the end of the enrollment year, so go in when they drop and document all of the end of year information. Okay. So we're doing the same piece. We had a problem. If you were, for those if you have been here for a while, you will remember that we used to do this in COPA, and we drew the beginning of year information from the health history, and then we had the health status of all the required screenings entered with their dates and outcomes into the system, and then it would determine whether they were up to date at the end of the year. We did that because the individual screenings we're looking at are dictated by the state in what is called the Early Prevention Screening Diagnostic and Treatment Schedule, so EPSDT. Well, what happened is in COPA, every year we would have more people up to date at the beginning of the year and then at the end of the year, and the number fell. So it looked like kids came in with everything and then fell behind, and we weren't doing anything to help them, which makes us look bad. This is not what was happening. What was happening is that people were taking parents' word for it and just putting up to date because the parent marked up to date on the health history and signed it, but parents do not know what the EPSDT even is. So you cannot take their word for it. You need to look at their physical, look at the information they bring in, and document whether it's up to date or not. And if it's not up to date, you need to help them get the other screenings. So a lot of people don't have blood work. For example, or they don't have an anemia screening, or they have some specific thing that's out of date. So you need to note that, make the determination that they're not up to date, and then help them get screened. So again, the number's not supposed to go down from the beginning of the year to the end of the year. So if you never saw a physical, if you never got any screening information from the family, they shouldn't have been marked up to date at the beginning of the year. That will stop them from going downhill if they never do get it. Okay. And I feel like this is a good place to take a moment. I've got somebody with their hand up. Anna, go ahead. If you are able to unmute.
Sorry, that was an accident.
Oh, okay. Okay, so another thing that PIR asks is if children have been diagnosed with a chronic medical condition by a healthcare professional. And then it lists some. So the list is not exhaustive, right? It's got a number of possible conditions here, and most of these are saying no. All right, and you can see again we've got some missing data here that needs to be filled in. So let me see if I have a bad one. But here you say this was yes, and here's a specific screening. This can be yes, and we don't have a specific condition identified here if their condition is not one of these. However, if any of these things say yes, so if it's in this case, what does it say? Vision problems. We have asthma, which is probably the most common here. Life-threatening allergies. Okay, if any of these things say yes, then this needs to say yes. So if I see a situation like this, where yes, the child is diagnosed with vision problems, right? Yes, they're diagnosed with asthma, but then I look over here, were they diagnosed with any chronic condition that says no. That's wrong. Okay, there's two of them over there. This should be yes. So these should agree. So make sure that they do. Again, here, yes. Life-threatening allergies. This says no. It should say yes. Okay. So keep an eye on that, because again, if we put a number of conditions that is more than the number of kids, we need to justify that statement. It could be because some children can have two conditions, but so we'll need to have a note to that effect. So we do need to make sure that these things agree as much as possible. We certainly can't have an agency say no to everything, but then identify several conditions. That just doesn't make sense, and they don't like that, and it may cause them to come back and ask us some more awkward questions. Okay. And we have disability services. So again, this is something that's a bit new for long-time Head Start people. Because we used to only ask about for the PIR, we would only ask which children had an IEP or an IFSP and what that condition was being treated. So what is a disability? And then really we didn't do much with that for early Head Start kids, but for Head Start we had to enumerate which conditions children had. And then what would happen is after we submitted every year, we would get asked to submit a waiver request for each agency that did not reach 10%. And when they came back to ask for the waiver request, that request had to include how many children were referred, how many children were screened, what their status was, and so on. So at one point they decided that they were going to come back and ask these as follow-up questions anyway, so why not make everybody's life simpler and just add them to the PIR. So now they are added to the PIR. So we're not just asked about children with IEPs or IFSPs, they're asking us the total number referred for an evaluation of those, the number who received one to determine the eligibility, IDEA being the Individuals with Disabilities Education Act. Right, of those who were diagnosed, of those who were evaluated, how many received a diagnosis? Of those who were not diagnosed, how many of those were you providing other services for them? 506 and 504, so on. So we added these things to the spreadsheet. So if you look at the disabilities tab, so we've got program enrollment type, disability status, but this can be for kids who have disability status of suspected for. So if they were referred, they should be here, and then complete the rest of this. Were they referred? If so, what was the date? Did they receive evaluation? So here, when agencies are saying they don't know, you need to follow up because we need all of this information. So if they were referred, were they determined to be eligible for services, yes or no? So if yes, then we need to know the IEP and the IFSP, the condition. If they were not, then were they receiving other services with the Color 504 plan? If they were not evaluated, so we referred them for an evaluation and never got one, then maybe we don't know why, right? Like they assigned them to an RTI, which is an alternative, like diversion thing. Instead, the parents refused the evaluation. It's pending or not yet completed. Or if it's not any of those, it's other, and then we need you to type in, like, what do you mean by other? Because we're going to have to summarize that when we submit the PIR. in a little text box. It'll come up as an error, and we'll have to say, you know, one child's evaluation is scheduled after the end of the program year. Another child's parent refused the school to which they were referred and is trying to get a different one. Whatever. Just notes on there so we can summarize. So that all of that is necessary in addition to the IEP information. Okay. Once that's in there, we fill this out for everybody. We can complete this page. So we just want all of it, not just the first half. But you see what I mean by that here? Like, there we've got, okay, we filled in the names, we put some of these things in here, but then over here, we didn't do it. So not just the first half, like, all of that information needs to go in for all the kids so that we can have the appropriate totals on the report. Okay, so family services are, again, the lines are created from the enrollment tab of the PIR, so you don't put the parents in automatically. Instead, we're pre-populating them. So the question that you get here then, this is so tiny. Okay, so the question that we get here then is, what do we do? These people were naughty and did not put on consent. What do we do for siblings? So I don't know if I've got any here, but in the case where you've got two siblings in the same program, like twins or a 1-year-old and a 2-year-old who are in the same early Head Start, you don't need to put the parent in twice. So you're going to go in here and you're going to just be like, duplicate. Yes, I can type. And then we will filter those out so you don't need to put the rest in for the parent more than once if they're on the same grant. However, if you have a Head Start child and an early Head Start child with the same parents, and both children are on this PIR, then we do need the parent information to be there twice, because one set of the information will go on the Head Start report and one section will go on the early Head Start report, so that both of them have enough parents on them. But for each report, we only need to include every parent once. So again, like this, the information from at enrollment should now be in here. So the end of the enrollment year, we're looking for this to be completed over the next 2 months with whatever status they have around the end of the school year, so that we can go ahead and put that up and enter that information. If you do deliver additional services, go ahead and include those, and we will take a look at the end of the year to see if the numbers have gone up. But we need to get the initial data entry done early in the summer. So here we've got now the family services received. So these are all specific types of services that we are identifying here based on being on the PIR. This is, again, right. So we've got family demographics as we need, but all of these types of services are here. So there is no place to enter additional kinds of services because there's nowhere to document that on the PIR anyway. So to report stuff, it has to be one of these services identified, and then at the end we will calculate how many families received at least one of these services. That is, if anything here says yes, this thing at the end will automatically calculate it and say yes. So again, we have the grant level questions. Like I said, we're averaging salaries for management staff. We actually got to take a year off from bugging everyone about it because we did a salary survey last year, and so we were able to just get the average over that. We probably will have to follow up with some people to get information for this year. The other pieces that we need here, we need qualifications for family workers, so make sure those are documented on the all staff tab. And then there is a question every year that we're trying to find. We also ask this on the all staff tab, and I also try to get information from our vendors to see if we can get to some kind of agreement. But the question that is asked is how many teachers received intensive coaching. So if anyone has a coach during this 2024-2025 program year, just note that again on the all staff page so we can get a head count of teachers who received coaching. There was a lot at one point. The number has gone down in recent reports, and I do not know whether that's true or we're just not getting good reporting on it. So make sure that everyone who has taken part in that program in the last year gets documented. Okay. So that is the PIR. Do we have any questions? You can put that in the chat if you do. I've got that open right now. I'm not seeing anything. If anyone has a question, did you want to unmute and ask? This is the moment. Otherwise, for specific details, you know where to find me. You know where to find the data team. So drop them a line. That would be Jennifer Santana, Miriam Chanillo, or Yannette Rodriguez. Me, I am still coordinating this right now as Assistant Director for Data Planning and Management, or Communications. Thing I'm not great at. For the moment, I'm trying to hire a new me, but I really don't know about the time frame for that. But eventually, there should be a new supervisor for data who can take this over. But in the meantime, let me know if you have any specific questions. Otherwise, please go back and take a look. If there is missing information on any of the tabs that should have been completed by now, please go fill them in, particularly on that first child enrollment tab. We need everyone to have their developmental screenings documented, their health history date documented, the reason for eligibility documented, and make sure that anybody who is dropped has an end date. So that is the most urgent first piece, but going forward from there, if you're looking at the health status and the family services status, please take a look at the end of the program year status and try to get that in there again. It says May 30th.
Question.
Yes,
Can
go
I
ahead.
ask a question regarding putting in screenings? What about if a child enrolls late? Does that 45 day, does that date change? Because I've
Yes, the
seen
date is based on their enrollment date. So
okay,
when
so
you
it
when
won't
you
change.
fill in their start date, it's going to do a calculation and give you a
Okay,
due date.
okay, thank you.
So I know you went over the duplication, where there's a lot of students over in there that's duplicated. Do you want us to put duplicate all throughout the screen, or just in one particular area?
So if the child is duplicated, like by accident, so the same child in the same program is in there more than once, the easiest way to take them out is just to um, go to their funding source. So if you have two kids, like this literally the same kid twice and it's both Head Start, I don't have it in this one. I guess ask one of the data team about this, because when we, for cases where we've noticed that there are the same child in duplicated status, we've added to this drop down a status of not federally funded. So you just remove the funding. In the meantime, you can go in here and just delete this, right? Because we're not doing one report. So anytime we're doing a report, we're filtering it by funding source. So if you remove it, it'll take them off the report.
Okay.
But when I was talking about putting duplicate in, what I'm saying there is, let's say you've got twins, okay? And so you put them next to each other, and then on the family tab, you're going to have the same, this is going to be the same parent twice. That's why we really don't want that, because it means that we were giving a total of the number of parents that are too high. So here you would, for the first time they're there, you'll go in and you'll fill in all the information about the parent. But then for the second time, just put duplicate. And we'll know to screen that out. So that's that's in the case where you've got two siblings in the same program. But if one of them is in Head Start and one of them is in an early Head Start program, we do need the parent in there twice, because those are two separate reports. So you will notice here when we, no, I'm already logged out. This is really timed. You can't stay logged into the Head Start and Pro system. Here, but for PIR, you'll notice we've got agencies with more than one. There's a Head Start one, there's an early Head Start. So this is where we get to like 50 reports, is we have agencies that have more than one grant. So if you've got two and the same parent is in both grants, you do need to have two lines for them, one of which would say Head Start, one of which would say early Head Start, so that we can include them on both reports. But we don't need them twice on the same one. That's the distinction. I hope that's clear.
I have a question regarding the developmental screenings.
Sure.
A child was enrolled in the program, became 1 day, and never came back. What do we do about the screening?
I mean, that is going to be missing.
Okay, thank you.
We've debated this. There's a reason that we don't have, or we don't want to include not screened or NA on there, and that's because we have done that in previous years, and people put that in for lots of children who were enrolled for more than 1 day. So if I see that they were in there, particularly if they're still enrolled, there shouldn't be a not screened status. If they're not screened, you should go and screen them. Now the exception is if their IEP says that they don't have to be screened. And that's a different piece. And then that is a justifiable reason. But if that's you're stating on there that the reason they weren't screened is that they have an IEP, then if I look on the disabilities tab, they should be there. Right? There's got to be a one-to-one correspondence between those cases.
Okay, thank you.
Okay. Do we have any other questions? If not, and I thank you for your time. And so I look forward to getting this done in a speedy manner here. If, again, if you have any other questions, anything else comes up, please feel free to contact us and we will try to resolve those as quickly as possible. So, thank you for being here today and taking the time out to do this and for all of the work that you do to help Chicago's most vulnerable children and families. So we do appreciate you. Have a lovely Friday.
Craig, really quick, is this going to
Yeah.
come the CSD update because I had to run out to support a child? Is
Mhm.
slides? Okay, great. So if I have a question, I will contact you. Thank you.
Yep, sure thing. And we recorded this, so it will be available soon. We'll send that on the update. So thanks a lot. Have a lovely Friday.